The world is monitoring the latest outbreak of Ebola in the Democratic Republic of Congo. The Africa Centers for Disease Control and Prevention has activated its Emergency Operational Center to monitor the situation. The World Health Organization has confirmed at least 3 deaths. At least 11 suspected cases have been reported in the DRC. The first case was a 39-year-old male who presented symptoms on the 22nd of April. He later died of the virus. The DRC's health ministry is trying to track down anyone who may have come into contact with the virus. Nigeria and Kenya have both issued alerts following the DRC outbreak. Meanwhile, World Health Organization Chief Dr. Margaret Chan spoke exclusively to CGTN. She says dynamic and transparent partnerships are already making a difference in the fight against Ebola.
This is their 8th Ebola outbreak, and the country has a very good system, well-rehearsed system, and the Minister of Health is very dynamic. The government is very transparent. As we are speaking, our teams of experts from the government as well as from the World Health Organization are on the ground trying to contain the Ebola outbreak.
I think right away it was your head of Africa, Dr. Moeti, who crossed into Kinshasa. And we're also hearing that mobile phones in the DRC instantly receive warning messages in the French language, of course. People have going on Twitter, social media, saying WHO is being really quick. Is this what you wanted to see? Is this the improvement that you wanted?
Indeed. I mean, this is a great improvement. And in a world that is highly interconnected, prompt sharing of disease information like Ebola is critical. But the government is also very smart to make use of, social media to inform the general public, and so that they know what to watch out for. And if they see unusual disease cases in human being, they can promptly report to government. So this is a new way of doing disease surveillance, taking advantage of the opportunity offered by ICT.
You're very calm, measured, but also very active as well. Is that also because just a couple of days ago, you were in Guinea to launch the first ever Ebola vaccine? My question is, how many doses do you have? Are they ready to go? Are you already using them?
It is about partnership, coming together of people so that we can take advantage of the tail end of the outbreak in Guinea, in Sierra Leone, and also in Liberia, thanks to their leadership and thanks to the government for giving us the opportunity to do the clinical trial. We found that the vaccine is highly effective. Now, yes, because this vaccine is not yet licensed for sale, but with the support of Gavi, the Global Alliance for Vaccine, we were able to procure a stockpile of Ebola vaccine for emergency use. Now, in this case, in Democratic Republic of Congo, what we can do is, with the permission of the government, in terms of their ethics committee, as well as their regulatory authority, WHO would be working with partners to support them to use this vaccine.
Very quickly, when you look at this vaccine, do you say that that's the game changer, that we don't need to have more people dying than on the scale that we had before over many decades?
Indeed, Ebola is a very difficult disease, and it caused a lot of unnecessary death. And in the past, there was no vaccine. The innovation in terms of having an effective Ebola vaccine is a game changer. It will prevent a lot of unnecessary deaths.